If you detect cancer early, it's far easier to treat, and that's led to the phenomenon of people getting full-body MRI scans. After all, why would you wait for cancer symptoms to appear, at which point it might be difficult or impossible to treat? Why then does the American College of Preventive Medicine recommend against whole-body scans? Let's dive in. First of all, they say that MRI scans are not very good at detecting cancer in people that don't have symptoms, that there are far better tests and strategies to detect specific cancers, and we'll get to those later in the video. They go on to say that no medical societies, so for example the American Cancer Society, recommend whole-body scans. And this is because often whole-body scans, they show up things that do not look normal, and almost all are harmless. For example, in one study of patients that had no symptoms, but they went through an MRI machine, 1/3 of them had suspicious findings that needed further tests, including further scans, biopsies and surgeries. And that's a problem because biopsies and surgeries are not harmless. I've got a very close friend who used to work as an MRI receptionist, and as part of the testing of that machine, they asked her if she wanted to go through and have a full body MRI scan. They found something suspicious in her liver, and despite other biopsies and blood tests, they couldn't figure out exactly what it was, and she had to go through an operation to remove half of her liver. And when they looked under the microscope, the lesion was benign. It was never going to become cancerous. So she had to go through that massive operation, have half of her liver removed for nothing. So any cancer screening program must be validated to show that it does save lives. So for example, when exploring how to design a lung cancer screening program, there was a large Danish study completed where they randomly assigned people into two groups. One group had their lungs scanned and the other ones had normal medical care. Shockingly, the group that had their lungs scanned, they actually had a worse death rate compared to the group that had no scans. This highlights the important point that any cancer screening program, it's not just about detecting the cancer, it's about making sure that we're saving lives. And when that lung cancer screening program was tweaked to only include people between the age of 50 to 80 who had a strong smoking history, then that program saved lives. Overall, that's one side of the story against having a full body MRI, that there are better existing cancer screening programs that have been validated to save lives. And any doctor who recommends full body MRIs is going against the recommendations of the various cancer societies. But here's the counter-argument to have a full-body MRI. It is possible that these full-body scans can be used in addition to the existing screening programs, and it does provide a unique opportunity to detect cancers that may have otherwise been missed from the existing cancer screening programs. And crucially, these scans do not expose patients to radiation or contrast injections. And in a large study, cancers were detected in nearly 2% of patients that went for these full-body MRI scans, which sounds like a very convincing argument, but remember, any cancer screening program, it's not enough to just detect cancers. We need to make sure that we're saving lives, and full-body MRI scans simply don't have that data yet. We don't know if the harms from biopsies and surgeries, because of the findings from full-body MRI scans, will actually save lives. But we absolutely need to investigate this, and there are studies ongoing. At the end of the day, it's your health, your decision, and after looking at all of this, you might elect to have a full-body MRI, and you have made an informed decision. Personally though, I would not have one of these scans until we've got that research to show that it does save lives, and I do not recommend these scans to my patients. So what can we do to detect cancer early before symptoms appear? Well, there's a heck of a lot actually. The American Cancer Society recommends that for breast cancer screening, women of the ages between 40 and 44, they should have the choice as to whether to start annual breast cancer screening, and this is using mammograms. Women 45 to 54, they should have mammograms every year, and women 55 and older, they should switch to having mammograms every 2 years. For colon and rectal cancer, the society recommends that regular screening should start at the age of 45, but if you do have a strong family history of rectal cancer, then that screening can start earlier. So for example, if you've got a family member that had colon cancer at the age of say 40, generally your screening should start 10 years prior. So when you are 30 years of age, that's for you when you should be starting your cancer screening. The screening can be done with either a stool test or a colonoscopy. Now generally I recommend a stool test because it's a non-invasive procedure, and this is for people between the age of 45 to 50. So if there is a positive stool test, then they need to go on to a colonoscopy, and regardless of what the results show, from the age of 50, I do recommend to my patients to get a screening colonoscopy. For cervical cancer, screening should start at the age of 25, and this includes being tested for HPV as well as a smear. Endometrial cancer is tricky. There's currently no validated screening program. However, all women should report any unexpected vaginal bleeding or spotting to their doctors. Moving on to lung cancer, and we've touched on this should include people who are between the age of 50 to 80 and who currently smoke or who have quit in the past 15 years, and who have got at least a 20-year smoking history. This strict criteria means that the program will save lives. Prostate cancer is another tricky one. There's currently no validated screening program that has been shown to save lives, so all men starting at the age of 50 should talk to their healthcare provider about the pros and cons of testing. Now, I want to talk about ovarian cancer because recently there was a massive study published. Over 200,000 patients were included, and they were randomized between a combination of ultrasound and blood tests or no screening. The study ran for 16 years, and unfortunately there was no reduction in ovarian cancer deaths between the group who had the screening compared to the group that had no screening. And therefore general population screening cannot be recommended, which is disappointing, and it does lead us to another interesting point. There's a new blood test called the Galleri blood test, which you can do, and it detects around 50 different cancers. Almost 1% of people who do this blood test, they will have a positive result, as in there's suspicion for cancer. But of those people with a positive test, they will go through additional scans and find that there is no cancer. So for those patients, they would have gone through all of that anxiety for nothing. This test has also not been cleared or approved by the FDA. Overall, here is my take for cancer screening programs. There are a lot of existing cancer screening programs that have been validated to save lives, and I wish all of my patients would do them. When it comes to whole body MRIs and blood tests, such as the Galleri test, they are very interesting, and I'll be following the research closely. However, before they can be recommended to the general population, they need to be validated, as in, they need to be shown to save lives. Not just detect cancer, but actually save lives. And I'm very hopeful that future studies do show that they save lives, and they can be used as part of an overall screening program to help detect cancer early. But in the meantime, I highly recommend that you use the existing cancer screening programs because they are validated to save lives. And make sure to check out this next video here, where I explain all of the things that you can do to prevent cancer in the first place. A massive thank you to DoNotAge.org for their $10,000 donation to my rapamycin study. They are a health research organization, and to benefit from their ingredients as well as a 10% discount code, check out the pinned comment.